Talha Aziz, and today the topic of my presentation is ECG. We are going to, the basic parts of our video are going to be the axis determination of the ECG. Okay, how we are going to find out by looking at an ECG strip that what is the axis of the heart, and the second one is the other part. In other part, we are going to learn about the 5 steps of ECG interpretation. So let's start the video. As on your screens, you guys can see that there is this basic structure of the heart. There is this SA node, AV node, we have got the bundle branches, and we have got the Purkinje fibers. Okay, so on this screen you guys can see the basic structure of the ECG. In the ECG we consist of a P wave, a QRS, and a T wave. The P wave is indicative of atrial depolarization, and the QRS complex is indicative of ventricular depolarization, and T wave is indicative of ventricular repolarization. The basic principles of the ECG are those. Number one, on the waves on the ECG paper are always representative of repolarization or depolarization. It means that whenever remember the thing that whenever the electrical activity of the heart is moving towards the lead, which is attached to the part of the body of a person, that lead is going to give us an upward deflection. And if the electrical activity of the heart is moving away from the lead attached to the body of the person, then we are going to have a negative deflection. A normal ECG has got 12 leads. Each lead watches the same thing. Each lead watches from different vantage point. Electrical activity towards the lead is always given on ECG strip as upward deflection, and electrical activity away from the lead is always given as negative deflection. Okay, this is QRS axis, QRS axis determination. The normal ECG axis lies somewhere between -30 and +90. This blue line, this blue arrowhead is the normal axis of the heart. This is the same labeled axis determination graph on your screen. These dotted arrows are showing the presence, showing the position of the position where normal axis of the ECG lie, which is between -30 and +90. If the axis of the ECG is lying in this compartment above between -30 and -90, then we are going to have left axis deviation. Same goes for this over here. If the axis of the ECG is lying somewhere over here, then we are going to have right axis deviation. Now let's interpret that how on ECG paper we are going to know, after looking at an ECG strip, how we are going to know that what is the axis of the electrical activity of the heart. First of all, whenever you get an ECG strip, you have to look at AVR. If the AVR is negative, then it means that there is no limb lead reversal. Remember guys, the AVR on an ECG strip is always going to be negative. If it isn't negative, then it means that the person who was taking or who was recording the ECG of a patient was doing it by applying leads on or just keep it simple. The leads weren't properly applied to their allocated limbs. So if the AVR is negative, then it means that if it's negative, then it means that there is no limb lead reversal. Then you have to look at lead 1 and lead 2. If both lead 1 and lead 2 are positive, then it means that we have got the ECG with normal axis. For left axis deviation, all you need is lead 2. Now if you've got lead 2 which is negative, lead 1 is positive, then it means that the axis of this patient's electrical activity is deviated towards the left side, and we are going to call this ECG as left axis deviated ECG of a person. For right axis deviation, you are going to need lead 1, and if lead 1 is negative and you've got a positive lead 2, then it means that you have got right axis deviation. So this is the whole summary of what I have just said in the previous slides, that first of all you have to look at AVR and you have to make sure that it's negative. If it's negative, there is no limb lead reversal. Then you have to look at lead 1 and 2. If both are positive, then you have got a completely normal axis. After that, you have to look at lead 2. If the above 2 points are in there, if you have got uh, if you've got some problem with lead 1 or lead 2, if one of them is not positive, then you have to make sure, and then you have to look further into lead 2 and lead 1. Now if lead 2 is negative with a positive lead 1, you're going to have left axis deviation, and if lead 1 is negative with a positive lead 2, then you have got right axis deviation. Over here, this is the graphical representation of what I have just said. Lead 1 positive, lead 2 positive, normal axis. Lead 1 positive and lead 2. Now this is another point. Over here I'm going to emphasize upon that. If you have got lead 1 positive and if you've got lead 2 in a way in which half of the lead 2 is positive and half of the lead 2 is negative, then this is physiological left axis, and this is not deviated left axis. This is a simple physiology. It can happen in certain situations. Now this is if you have got positive lead 1 and if you have got negative lead 2, this is left axis deviation, and similarly if you have got negative lead 1 and you have got positive lead 2, then it is right axis deviation. Now I'm going to talk about some 5 steps that how we are going to interpret an ECG. These are the basic easy 5 steps. Number 1, first of all, you have to look at the P waves. If the P waves are present, then you have to move further. Step 2. If P waves are present, then you have to look further into the rhythm of the P wave. You have to determine that the rhythm of the P wave is regular or is it irregular. If P waves are present with a regular rhythm, then it's sure that you are going to have a sinus rhythm. Or in rare cases, there is a chance that you are having a person with you're having an ECG of a person who is having atrial tachycardia or atrial rhythm. If there are no P waves and you have got irregular rhythm, then this is the ECG of atrial fibrillation. Atrial fibrillation is known as the condition in which the ECG is irregularly irregular, and the other condition in which there are going to be no proper P waves and you are going to have an irregular rhythm is that of atrial flutter with variable block. So this is the depiction of step 2. What I have already said, that in the above strip you can see the rhythm is regular. The QRS are equally distant from each other. In the lower down strip you can see the QRS are unequally distant. So this is an ECG with irregular rhythm. Step 3. In step 3 you have to determine the QRS. If the QRS is narrow, then it means that the Purkinje system is working well and there is no bundle branch block present. If the QRS is wide, then it means that there is a bundle branch block present, or you are going to have a rhythm with ventricular focus, or you're going to have a ventricular rhythm or ventricular tachycardia. How we are going to determine simply on the basis of the number of boxes that the QRS complex is narrow or wide. So 3 small boxes. If the QRS complex is lesser than 3 small boxes, then it means we are having a condition of a narrow QRS complex associated with normal Purkinje system and no bundle branch block. So this is again the same slide. Step 4. Okay, step 4 is you have to check the intervals. Let me summarize all those points. In step 1 you were looking at the P waves. In step 2 you were looking at the rhythm that the P waves associated. If the P waves were present, that the rhythm should be regular or irregular. Then step 3 you are looking at QRS complexes, and in step 4 you are checking the intervals. PR interval, and we have got QT interval. PR interval. If PR interval is prolonged, then it means you're going to have an AV block. If PR interval is prolonged, it also can mean that you are having your patient or the person is using some drugs which can increase the vagal tone, and the PR interval can also be shortened in condition in which you are using beta agonist, or you're using stimulants, or you're using certain drugs which causes the cardiac activity of the heart to increase. After that we have got QT interval. If QT interval is prolonged, it can indicate tetany or tetany, and if prolonged, QT interval can also be prolonged by certain antiarrhythmic drugs that include class 1A sodium channel blockers, and similarly class 3 potassium channel blockers can cause the enlargement of the QT interval, and QT interval is shortened by hypercalcemia. Step 5. Step 5 is at the end. This is the last step of an ECG interpretation, and this step you have to look at the ST segment. If the ST or T wave is inverted, then it means you're having a condition of ischemia. If it's peaked, then it means you're having an early ischemia or hyperkalemia. If it's flat or U waves, it means you're having a condition of hypokalemia. If the ST depression is, if you're seeing ST depression, it can also indicate subendocardial ischemia, and if you're having an ST elevation, it is indicative of transmural ischemia.